Hi, my name is Kayleigh Bernardo. I'm an emergency care practitioner and I work for the 1cc Foundation as the clinical program coordinator for the critical care ambulance based at Nelson Mandela Children's Hospital. I've always been inspired to work with pediatrics and neonates from my own personal family experience. I've just always found a passion for wanting to help children who are in need. It really pulls on my heartstrings, and so focusing on that specialization is really important for me. I think it's a really amazing partnership with lots more growth to go forward. We are both focused on pediatrics. Nelson Mandela Children's Hospital is a purely pediatric, obviously neonate-based hospital, and our ambulance is striving to do the same. We have equipment there that is dedicated specifically to pediatrics and neonates that most of the ambulances out there won't have. And so we've really tried to match that level of dedication to a specific patient group so we can offer the best level of care. Also, part of that relationship is that we're based here at the hospital. So whenever they need us to transfer out, we're literally right here. It takes us like 5 minutes. It's a fast response time, so we can really assist them with any delays that they used to face in having ambulances come to the hospital. Now we are a hospital-based ambulance, so that's really assisting them in that way. And then I think lastly, we're both NGOs, Nelson Mandela Children's Hospital and 1cc Foundation. We're striving to provide free care so that no patient gets priority because they have medical aid or because they can pay cash. Everyone's getting the same level of rapid quality service, and that's what both of the NGOs are striving to do. So we have some fantastic specialized equipment on the ambulance, as I mentioned before, that's specific to neonates and pediatrics, that most ambulances out there won't have, especially those not dedicated to critical care or dedicated to neonates specifically, of which there is not many. So, for example, to give some examples, we have a ventilator that has the modes to ventilate neonates. We have a humidifier, we have an incubator, we have a neopuff, which can provide safe resuscitation to neonates. We have a wonderful patient monitoring system that can monitor very advanced things such as intracranial pressures, intraarterial pressures, end-tidal CO2 monitoring, all kinds of things which my medical colleagues will know is providing a higher level of monitoring and care for these patients. Our technology in the ambulance, I cannot state enough how much that's been a huge help. I think what we've got in the ambulance is really one of a kind. It's very groundbreaking, very new. We have telepresence, we have telemetry, where the doctors can literally visualize the vital signs and waveforms of a patient from the hospital. So to share some success stories of how this has worked, it's been fantastic that when we get to a transfer where we're bringing a patient, a critical care patient, who requires an ICU level of care from a very outlying rural area where they don't have that level of care currently, we're actually able to consult with the specialist here at Nelson Mandela who will be receiving the patient and give them an update on the status of the patient. What can we start to initiate? We're essentially trying to bring the ICU to the patient already where they are, instead of rather having the first ICU contact be once they arrive at Nelson Mandela Children's Hospital. We're able to forward that by like 2-3 hours to when we arrive, and we're already started to put in place all those interventions and whilst consulting with the specialist, and that's been really amazing. Yes, so we've had quite a few cases now where we've had the doctors assist us with sedation issues, ventilation issues. On separate cases, we had a case recently where we've had a doctor assist with inotropes, etc. Those kinds of things where we reach a patient and we realize that something needs to be done, an intervention needs to be made, or where we are starting to make interventions but then we're struggling to achieve the goals we're trying to reach, we can consult and they can give us higher specialist level of advice that you can get from a neonatologist. So I think on that, the hospital has already started doing an amazing job on that. I've seen a lot of the patients come from very far out, very remote areas, very rural areas, and we see that when we take them back to their base hospitals. And they've also got this amazing system where they're able to accommodate some of the parents as well at the hospital for those who have to travel hours and hours to get specialist care. And us as 1cc Foundation are trying to also provide the same level of attention, deserving attention to those to that struggle that a lot of parents face, and that we're trying to, we have an increased radius that our ambulance will travel in order to assist these people who are quite far out. But also we're looking at getting a fixed wing as well as a helicopter. And that's quite far into the process now. And we're very excited about that, hopefully being implemented very soon. And that's just going to decrease transport time like enormously. Also going to increase radius enormously. And we would essentially, when we're looking at the fixed wing, be able to bring a child from anywhere in South Africa to a specialist paediatric hospital like Nelson Mandela. So I think what we all need to recognize as healthcare practitioners, wherever we are in the hospital, in the ambulance, is that pediatrics is such a special patient population. The neonates are a special patient population. They require such a specific level of care, such specific equipment, specific training for the staff in order to really provide quality care to these patient groups. And I think with that recognition comes a lot of responsibility. And what I would recommend to other healthcare practitioners, services out there, is to really work on a system where you recognize where your weaknesses are in pediatric care, in equipment, in training, trying to implement specific neonatal pediatric training for your staff, and also collaboration is the biggest thing. I understand that not everyone's going to be able to have a monitor that can teleconsult or have the software where they can teleconsult easily. But if you have someone who you can consult with, a pediatrician, a neonatologist, someone who has that expertise, is just absolutely crucial and goes such a long way in the kind of quality care you're going to give to that patient. You're essentially able to bring the neonatologist or the pediatrician to the hospital bed through yourself and through your communication. And I think that's really my advice.